Morning to all of you.
Good morning,
So,
sir.
Good
Good
morning.
morning, Prof. Sandeep.
yes, good morning and welcome.
Shuna sir.
So,
Hello.
Madam Devi
Uh,
from Indonesia, all of you joined.
Yes, sir.
Do-
I'm
Dr. Ramesh
here.
sir
Join.
joined from India. Hello,
yes,
Dr.
yes,
Ramesh.
we all join. Dato Bibi
Dr.
will just.
Ramesh. Dr. Ramesh sir have joined. Hello. Gomati Madam joined. Here, welcome all of you and very good morning and good afternoon from Malaysia. We are celebrating the World Health Day today, and focal theme of today's event is Together for Health, Stand with Science. So we have invited Dr. Sujitra Pal from India, and she has actually said 1 minute.
Yeah, good afternoon. I'm in the airport, by the way.
Okay.
Yeah, yes. Oh, you want to speak now?
Yes, we just started. I just shared the screen for the poster, and
Okay.
I have told that we are going to start on World Health Day, that Together for Health and Stand with
Yes.
Science is the focal theme.
Hello,
Okay.
And Dr.
hello,
Sujita Madam is speaking on nursing management of CKD patients and recent trends. So, Dato, you
Okay.
please, as the editor in chief of Malaysian Journal of Nursing and
Uh-huh.
first director of Nursing Board Malaysia, and Register
Mm-hmm.
of Nursing Board Malaysia Ministry, you are the pioneer of Malaysian Journal of Nursing. So we want that you speak first. Thank you,
Thank
Madam
you.
Dato.
Yeah. Okay. So, okay. Hi, everyone. I think it's a good afternoon to all of you. I'm so sorry I have to speak somewhere in the airport because I'm going somewhere. But okay, today in conjunction with the World Health Day, I'm honored to speak on an important and growing health concern, that is chronic kidney diseases or CKD. So this meaningful event is actually proudly organized by the Malaysian Journal of Nursing, in which I'm the chief editor actually. And that is a platform that continues to advance healthcare knowledge and professional practice alongside the contribution of Nurses Journal Network, which plays a vital role in connecting nurses, strengthening collaboration, and promoting evidence-based care. Ladies and gentlemen, chronic disease is often called a silent disease. Many patients do not realize they have it until it is progressed to an advanced stage, unfortunately. So CKD affects millions worldwide and is closely linked to conditions such as diabetes, hypertension, and an aging population. The management of CKD is not just about treating kidneys, it is about managing the whole patient. So firstly, I think all of us know that early detection is the key. Regular screening, especially for high risk groups, allows us to identify CKD early and slow its progression. Simple tests like blood and urine analysis can make a life-saving differences. Secondly, patient education and empowerment are crucial. Patient must understand the condition, medications, and dietary restriction, and of course the lifestyle changes. So when patients are informed, they become more active partners in their care. So we have to know that. Third, multidisciplinary care is essential. So basically, doctors, nurses, dietitians, and pharmacists must work together to provide holistic care. So nurses in particular play a very central role, from monitoring the patients to providing counseling and emotional support. Fourthly, lifestyle modification cannot be overemphasized. Healthy eating, reducing salt intake, controlling blood sugar and blood pressure, staying active, and avoiding harmful substances are all critical steps in slowing CKD progression. So finally, for patients in advanced stages, renal replacement therapies such as dialysis or kidney transplantation often offer hope and improve the quality of life. However, these come with challenges, emotional, physical, and financial, of course. which require strong healthcare support system. So, dear colleagues, I'm so happy to be with you today. So, through this organization, like the Malaysian Journal of Nursing, we continue to strengthen knowledge sharing, research, and professional excellence. So, these platforms empower healthcare providers to deliver better, safer, and more compassionate care to CKD patients. So, in line with the spirit of the World Health Day, let us reaffirm our commitment to promote prevention, to enhance early detection, and to provide patient-centered care. So, because ultimately, managing CKD is not just about prolonging life, it is about improving the quality of life. So, let us work together to ensure that no patient faces this journey alone. So, anyway, thank you, Dr. Poda, for your organization on this thing. And I'm so happy with all the attendance this afternoon. So, I wish you all the best, and may we all, can continue to do this all good deeds. So, God bless all of us. Thank you very much. Assalamualaikum.
From USA, Philippines, Sabah, and India, Indonesia. And Dr. Devi have been arranged in the classroom also. The students is joining. India also, they are joining from classrooms. So now introduce our speaker, today's speaker. You have already seen the poster. And Dr. Suchitra Pal. Dr. Suchitra Pal have, you can see the poster, I think. More than 27 years as a Chief Nursing Superintendent of Central Hospital, Southeastern Railway of India. And she has earned PhD nursing from Lincoln University College itself and master's degree from West Bengal University of Health Sciences, Kolkata. Her doctoral research focused on chronic kidney diseases, reflecting her strong commitment to improving patients' outcome in the critical area. She has also held a postgraduate diploma in health and hospital management. She has several publications in Scopus Index and peer-reviewed international journals like Bentham, Open Science, Open Nursing Journal, etc. So without wasting much time, we just request Dr. Suchitra Pal to talk on nursing management of CKD patients' recent trends. Thank you.
Much,
And what to
Professor
Dr. Suchitra Pal. Welcome.
Bibi Florina Abdullah, Pro-Chancellor, Lincoln University College, and Editor-in-Chief, Malaysian Journal of Nursing. My heartfelt thanks to the organizer and my sincere thanks to Professor Dr. Sandeep Poddar, Deputy Vice Chancellor, Research and Innovation, Lincoln University College, Malaysia. I'm Dr. Suchitra Pal, Chief Nursing Superintendent, Central Hospital, Kolkata, India. Very good morning, and I'm really honored to get this opportunity to talk on this special day. On the occasion of World Health Day with the theme Together for Health, Stand with Science, clearly reflects the care of CKD patient is reflecting that the need for collaborative care and the importance of evidence-based practices in improving patient outcomes. Today, I'll be discussing on nursing management of chronic kidney disease patient recent trends, focusing on how nursing care is evolving to meet these growing global challenges. All of you know, CKD may be defined as abnormalities of kidney structure or function lasting for more than 3 months. Let me begin with a simple scenario. Imagine a patient sitting quietly in your outpatient department. No major complaints, no symptoms. Yet nearly 70% of kidney function is already lost. This is the silent reality of CKD, a progressive and often unnoticed decline in kidney function. And that is exactly what makes CKD so dangerous. Today, CKD is no longer just a clinical condition, it is a global public health challenge. Moving to the prevalence of the disease. According to Global Burden of Disease in 2023, more than 850 million of people aged 20 years or older are diagnosed as having CKD. The prevalence increased by 14.2% from 1990 to 2023, and most of whom live in low or low to middle income countries. CKD is the 9th leading cause of mortality globally. It is the 12th leading cause of dialysis, and it is predicted to be 5th leading cause of mortality by 2040 in India. This alarming rise in CKD is mainly related to rising diabetes and hypertension, aging population, lifestyle changes, and obesity. This trend not only reflects the disease progression but also in gaps in early detection and prevention of the disease. This despite the growing burden of many cases remain undetected until complication arise. Let me illustrate with a real case. I got this case during my PhD study. A 22-year male patient presented with rectal bleeding and generalized weakness. On evaluation, he was found to have severe anemia. Hemoglobin was 6 gram per DL and impaired renal function test with serum creatinine 2 milligram per DL. EGFR was 54.6 ml per minute per 1.73 meter square. Urine examination showed significant albuminuria. UACR was 121.7 milligram per gram. Further history revealed that he had a history of self-medication with tablet diclofenac 50 milligram twice daily for nearly 2 years due to unresolved dental pain. Endoscopy revealed colonic ulcer, while kidney biopsy showed chronic ischemic changes with interstitial fibrosis, which was suggestive of chronic kidney disease. He was diagnosed with NSAID-induced lower gastrointestinal bleeding with early changes of CKD. This case highlights how unsupervised and prolonged NSAID use can lead to GI bleeding and CKD. This case report is already published in a Scopus journal in 2025. Now, can you tell me what were the cause behind the case? The causes were lack of knowledge regarding side effect of NSAIDs, long-term exposure of a known nephrotoxic drug, higher tendency of self-medication and non-compliance to medical supervision, and apprehension and anxiety for surgery leading to prolonged reliance on harmful nephrotoxic medications. Now, the changing paradigm in CKD care. In recent years, there has been a significant shift in the way we approach for CKD patients. Traditionally, CKD management was disease-centered and provider-driven, where healthcare professionals made decisions with minimal patient involvement. However, this paternalistic model is no longer sufficient, especially for a chronic condition like CKD that requires long-term management. Today, we are moving toward a more effective approach that is called patient-centered care approach. And this approach is based on few principles such as care with dignity, compassion, and respect, coordinated care across healthcare services, personalized care addressing clinical, emotional, and social needs, and patient empowerment for active participation. Patient-centered care fosters a partnership between patients and healthcare professionals, aiming to improve communication, increase satisfaction, and deliver better health outcomes by treating the person as a whole, not only just the disease. Most importantly, patient-centered care is delivered through a multidisciplinary team approach, including nephrologist, general physician, nurse, dietitian, pharmacist, and so on. Among them, nurses play a major role in coordinating care, educating patients, and ensuring continuity. This shift towards patient-centered care is especially important in low to middle income countries where resource constraints demand more innovative, sustainable, and patient-driven approaches. This patient-centered care brings to important concept of shared decision-making and patient empowerment. In shared decision-making, clinical decisions are made collaboratively, combining clinicians' expertise and evidence-based practice with patients' values, preferences, and life circumstances. Patient empowerment enables patients to take control over health decisions through knowledge, adequate skills, and ongoing supports. This approach ensures patients are not passive recipients but active partners in their care, leading to better self-management. Ultimately, when patients are empowered and actively involved, we see better health care, improved outcomes, and enhanced quality of life. Now, implementing shared decision making in CKD. What are the challenges and what strategies to take to overcome those challenges? Mainly, a high patient load limited time for comprehensive discussion, diverse practice settings such as individual or institutional setup, limited awareness among healthcare professionals, and limited knowledge of the patients regarding self-decision making, shared decision making. So the strategies to overcome those challenges are mainly frequent awareness program and training program for the healthcare professionals, using of decision aids and educational tools to simplify complex information for the patients with variable literacy level, and to promote patient engagement, encourage the patient to ask questions, to share their preferences and values so that decisions can be taken easily, and optimize time and workflow. So integrate shared decision making in daily care, routine care. So what are the key areas of shared decision making in nephrology? During kidney replacement modality selection, whether the patient should go under hemodialysis or peritoneal dialysis or home dialysis, that has to decide. During conservative management, those patients who need non-dialysis care, the elderly patient, comorbid patient, that decision we have to take. During dialysis initiation, the actual time of initiation of dialysis, that has to decide based on symptoms or quality of life of the patient, not just calculating the EGFR. During kidney transplantation, we have to decide the donor should be living donor, deceased donor, or preemptive transplantation is needed or not. During advanced care planning, end of life care or withdrawal of dialysis, or what decision we have to take, that has to decide. Then genetic testing decision, it has impact on diagnosis and treatment pathways. It can help in early diagnosis. It guides in treatment decisions, and it is important for family screening and family counseling. Another important area is pregnancy in CKD. Planning and risk-informed decision-making is required in this area. It requires pre-conception counseling regarding risk in maternal health and fetal outcome. Careful monitoring and multidisciplinary care throughout the pregnancy is required. So together, this approach ensures that care is not only clinically effective, but also continuous and patient-centered. For effective communication, open communication, shared perspectives of both healthcare personnel and patients, and evidence-based practice and personalized care is very much important. This is the spectrum of nursing care for CKD patient. In this care process, patient remains in the center of the process, and nursing care evolves around the four main components. Firstly, early identification of disease, as CKD remains mostly silent. So this is very crucial. Patient-centered education, nurse must ensure that her patients are educated sufficiently by addressing the knowledge gap, by initiating patient activation, by supporting self-care management, by increasing public awareness, and by providing emotional support. Virtual healthcare enables to continuation of care and follow-up of the patient, and coordination of care is related to collaborating the other healthcare professionals in the CKD care. Now, another important trend in CKD care is self-management. Nurses must play a critical role as educators and facilitators in this area. Nurse must ensure about the medication safety of the patients. She must ensure that patients should avoid nephrotoxic drug like NSAIDs, use of over-the-counter drug, frequent use of antibiotics, magnesium-containing antacids, and so on. And regular monitoring of health parameters, such as regular checkup of blood pressure, blood sugar, urine test, and other blood test. To follow dietary and fluid restriction according to their clinical condition and as advised by their physician or dietitian. To adopt healthy lifestyle practices such as monitoring of body weight, regular exercises, smoking cessation, and avoidance of alcohol. And most importantly, adherence to the treatment protocol. So CKD not only affect the physical aspect of the patient, it affects the whole, all aspect of the human life. Hence, nursing care must be holistic. In physical dimension, patient experiences many symptoms like fatigue, anemia, itchy skin, breathing difficulty, nausea, vomiting, and many more that require ongoing management. In psychological dimension, anxiety and depression are highly prevalent, mostly for disease progression and lifelong treatment. And this psychological issues impact on the treatment adherence of the patients. Financial impact of the CKD is mainly high cost of dialysis and medication, loss of employment, and out-of-pocket expenses. Social burden is mainly due to social isolation, reduced productivity, and dependence on family members regarding their care. These challenges highlight that CKD affects health-related quality of life among the patients. Nurse must play a vital role in providing emotional support, encouraging coping strategies, and involving family members in their care. Now, what are the barriers to treatment adherence? Mostly lack of knowledge, cultural beliefs, financial constraints, and limited access to care or technology. Now, future trends in CKD care are AI-assisted decision making. AI can help in early risk prediction, identifying disease progression, and supporting clinical decision. Personalized treatment plans, care becoming more individualized based on patients' clinical condition, lifestyle, and preferences. Nurse-led clinics, nurses are taking a more active leadership role in monitoring patients, providing education, and ensuring continuity of care. Community-based intervention, extending care into the community, helps in early detection of the disease, public awareness, and better accessibility, especially in resource-limited setting. Another major advancement is the integration of technology into CKD care. Mostly telehealth. Telehealth allows patients to consult healthcare professionals remotely, reducing the need for frequent hospital visits. Mobile applications, mobile apps help patients to track their blood pressure, medications, and diet. Artificial intelligence, AI-based tools can assist in early identification of kidney function deterioration and risk prediction. Hence, these technologies support in remote monitoring, early detection of complications, and personalized care planning. To conclude, I must say that CKD is a growing global challenge, but it is also a powerful opportunity to nursing leadership. By embracing recent trends such as patient empowerment, technology integration, and holistic care, we can significantly improve patient outcomes and quality of life. Technology may predict disease, but nurses influence behavior of patients and practices of patients and ensure treatment adherence. When we stand with science and work together, we do not just manage CKD, we transform lives of the patients. So these are the references. Here are a few examples of articles published in Malaysian Journal of Nursing. These articles are related to chronic kidney disease. If you have your manuscript, you can submit in this journal. This is a Scopus journal. Thank you for your kind attention. I'll be happy if you have any question.
Thank you,
Thank
madam,
you.
for the deliberation. And I think any participant want to take any question. Madam Devi, any student want to ask anything, can put in chat box and show the Malaysian Journal of Nursing website. You can see here. And when you go down, scroll, and you can see here the keywords. Here, if we click on the keywords, then we can have a search option, and there we can write CKD, and we can see the articles published in related to that area, like these articles. All you can see, and all is open access. So all related to CKD is coming here, like hemodialysis patient, published in 2024. And all articles have Plumex metrics, you can see here. Then you can click on Plumex metrics, you can see the citation, where it is cited, and mainly how many percent have been cited or some, all detail you can see here. And if you also in the dimension batch also there, there you can see the articles where it is citation and etc. Because publication is not only that what we know, it is sharing with this platform with publication. So everybody should aware about that. So we are making all types of open access and etc. And as you know, this is already in Scopus Index journal and it is Scopus Q4 ranked. You can see the ranking here. It is in general nursing is quarter like Q4. And for Scopus content coverage, you can see from 2019, the articles and Scopus content and also we are running now 6 issues in a year. Previously, it is 4 issues. Now we are running 6 issues. And I'm again thankful to Madam Sujitra to giving the valuable talk. So any is a question that in the chat box, Madam can see, Sujitra Madam. What about the prevalence of CKD among pregnancy? And is there risk factors can detect an early screening?
Risk factor about the preeclampsia for the mother and high rise of blood pressure, and for the baby, the intrauterine growth retardation is the main probable complication, and that's why the monitoring of the baby is required throughout the pregnancy, and frequent screening is also needed.
There is another question in the chat box. What is the management of to delay the progression of CKD?
Progression of CKD can be reduced to certain extent by giving the education to the patient how to manage the disease by themselves adequately. By self-management, I mean that diet, exercise, control of blood pressure, blood sugar, regular exercises, and making all those habituary means adopting the good habits in lifestyle modification, that creatinine can be controlled to some extent if the patient can practice all these good habits. And frequent monitoring, frequent checkup is also necessary, and most importantly, adherence to the treatment is the most important thing.
Hello,
Yeah.
please tell.
Hello. Good afternoon.
Yes, Madam Devi.
Yeah, Dr. Dr. Suchitra, thank you for your overview regarding with the chronic kidney disease management. Well, this one is a need to consider about how to taking care of the patient with the chronic kidney disease. As I mentioned before, that I'm agree that the based on your presentation that paradigm should be moved to the patient-centered care. It means that we need to empower the patient and also the family to, to sustain their quality of life, especially manage the diet and also the water intake and also how to taking care of their IV son. So just wanted to share that in Indonesia, maybe we also empower the support system around the community. You know that one of the nursing in public healthcare facility also train the family to handle to maintain their lifestyle and also to to train them how to manage their activity daily living so they can monitor about the quality of life also. And we also have a kind of a digital technology such as Hello Doctor. This one is a application that patient can ask, everyone can ask about regarding how to solve the problem if they have a problem with their health disease. I think it's a good share to how to maintain their quality of life also. Thank you. It's not the question on just give a sharing in this journey. Thank you.
Thank you, Madam Devi. And we come to know that the Hello Doctor for CKD management, the Hello Doctor software. So maybe in other countries also have some software. Maybe we can investigate that what are the softwares used in different countries. and which can relate to CKD and other diseases separately. So
Yeah.
very good aspect. So we can work on that also, that which softwares can be used for monitoring and management of CKD. So that
Yeah.
was a very good suggestion. Thank you, Dr. Madam B.
Yeah, thank you.
Okay, so if there is no question, you are always welcome to see, and also there is a certificate of appreciation to Dr. Sujitra Pal for giving the invited talk here today and enlightening us with the basic knowledge of about the CKD. Thank you, madam. Kindly accept.
Thank you, sir.